I'm sorry. Good afternoon. Day has gone by really fast, but I am so glad that you all are here with us today for the kickoff of this open enrollment period for the Affordable Care Act and the health insurance that goes with that. I do want to recognize our State Representative Joe Armstrong, who is here. Also, our former mayor and our current City Councilman Dan Brown. And I don't have my glasses on. Yeah, let's give them a round of applause. Who else? And Tank, is that Tank there? Yeah. Tank Strickland, who's our Community Relations Director. He just rolled in. Anybody else there? Elected position? Appreciate all of you being here. I do want to say some thank yous, because something like this, having these open enrollment events over the next couple of months, 3 months I think it is, November, December, and January. It takes a lot of people who make this come together. And I want to thank all of the volunteers and of course all those who come, the enrollees, those who come to find out what their options are. I want to thank Pastor Darrell Arnold from here at Overcoming Believers Church for hosting us today, as well as Pastor Kim Watkins and Kay Stokes, all of them from Overcoming Believers Church. I'll tell you, OBC is such a great resource, not only to this neighborhood where we are, but throughout our city. And we work with Pastor Darrell Arnold very closely on a number of issues, including the Save Our Sons initiative that we have. I also want to thank Cherokee Health, and they're represented today by Tish Quillen and Derek Folsom. We appreciate all of their help. Also June Jones and the volunteers from Enroll America, Walter Davis, Carl Wheeler, and all of the volunteers with the Tennessee Health Care Campaign, and the navigators from Knox Area Project Access. So we are all here, we are all working together in this big coalition in order to make sure that people in our community, that residents of Knoxville and the surrounding areas, that they know what is available to them. Well, look, the Affordable Care Act is health insurance that is available to people in our country, and this is now an open enrollment period. We want to make sure that our folks who live in Knoxville, that they know what their options are. They can come, they can talk to somebody who is an expert on it. They can help walk them through the process and know what the options are. They don't have to choose it if they don't want it, but we just want them to be informed because we know how important health care is to so many people and their families. I know, and many of you probably have the same feeling, when you go to do your, like right now we have open enrollment for the city of Knoxville. You have to sit down, you have to plow through all the different options that you have. It's not easy. It's not easy to do that. We have an employees benefits department who will sit down with us and explain what those options are. Well, so I understand how important it is to have that kind of support. So these enrollment events provide that kind of support to people who are considering getting health insurance under the Affordable Care Act. So it's very important that someone sit down and one-on-one help explain. So if you're somebody looking for insurance, you don't have to feel bad about needing help. All of us need help. We all need some advice on what our options are when we choose our health insurance. As you graduate from college and you are in the workforce, if your employer, ideally your employer would provide health insurance for you. But if that's not the case, then you want help, you need, and you're required to have health insurance. And so this is one option for you. Certainly there are many models out there, many things you can look at, but this is a program that is available to people in our country. And again, there are trained volunteers who can walk you through step by step and help you understand what your options are. Well, there's a big coalition of people many of whom are here today, who have come together to offer several different enrollment events, several different opportunities for people to come in and to sit down and learn about their options. If you live in the city of Knoxville, call 311 or near in the Knoxville area, call 311 and our operators at the city can tell you some of your options for other events. So what I want to do now is to introduce somebody who has driven from Nashville today to be with us. She works with the U.S. Department of Health and Human Services. April Washington is a veteran, award-winning journalist and media governmental relations professional with more than 20 years in the communications profession. So she has extensive experience in public affairs and community relations and is now a public affairs specialist with the U.S. Department of Health and Human Services. We really do appreciate her being here today. Ms. Washington?
Thank you, Mayor Rogero. I appreciate it. Thank you. Thank you for coming out. Truly want to thank everybody for helping us kick off open enrollment, what we call 3.0. It's the third year. We really thank all the volunteers out here because without them, we wouldn't have been able to get their neighbors, their friends, their relatives enrolled in important health care throughout the state of Tennessee. And I've been through the state of Tennessee this week. Just like she said, I just came up from Nashville. Our headquarters is really based in Atlanta, but we're all over trying to make sure we get a good start to help to the insurance marketplace. So far, we had a great start on Sunday. We had about 60,000 people enrolled on the first day, and we had over 600,000 people who actually went to healthcare.gov and did some window shopping looking at their plans. And like she said, you have a lot of local help in this community, but most of all, throughout the state, we have incredible coalitions that have worked hard. And if it wasn't for the volunteers, most people in this state would not be enrolled at the level they are. In this state, enrolled over 200,000 people is passing the law. 50 million people did not have health insurance, including 10 million children. So now the Affordable Care Act gives them access to affordable health care and making sure they can get the coverage they need and the peace of mind, security they need for their families. But we really want to thank you. Thank you for all your hard work. Open enrollment has started. It starts and runs from, the mayor mentioned, from November 1 through January 31st. So it's going to be through the holidays. So we're going to ask you to really pay attention to the holidays. I know we all have family and friends who will be celebrating the holidays with us, but make sure you put your health first. Thank you.